Actually, this time we're going to be flying in the patient's heart by drone. Yeah, but I'll tell you more about that at 3. Thanks. Hi, Ellisha. This is Jim. I'm Jimmy Thunder. I'm going to be the doctor for that's going to be replacing Lee Henry. Nurse practitioner Lee Henry is away on mat leave, and so I cleared it with the school, and everything is in order.
Okay, well, nice to meet you. I know you're busy, so I'll just skip right ahead with my assessment.
Great.
So, the patient I'm presenting to you today, his name is Mr. V. He is 60 years old. He's a male patient of African descent with a history of hypertension, motor vehicle accident times 2 years history. He presents with a one day history of pain to the lower back and numbness and tingling. Well, he described it as pins and needles running down my leg, he says. And he says there's a lot of burning sensation down that same left leg. This is the first time I'm meeting Mr. V. It's not his routine follow-up visit, so it's more of an urgent visit. Now, in terms of a background on Mr. V, Mr. V has previous cervical radiculopathy associated with the motor vehicle accident. In 2017, he says it's of no concern today. He has had aggressive physiotherapy, and the last time he had symptoms was like 1 year ago. His blood pressure is well controlled, and he's on perindopril 2 milligram daily. So overall, he says he's been doing well, except he was helping his friend yesterday to lift some heavy boxes. And he says after lifting a few, he noticed this sharp pain to his lower back, radiating pins and needles radiating down that left leg, like we said. So the onset 14 hours ago prior to the visit to this clinic. He did point to his lower back, to the lumbar region for the location, and he also pointed to the left buttocks radiate, and he points all the way down to the left toe, saying that's where the burning sensation radiates. Pain, the duration, he says it's constant. It's sharp and burning, like we talked about. Aggravating factors, he says, whenever he moves from sitting to standing position, and whenever he walks, it gets worse. It's not relieved by sitting. And he says he did take Advil 7 hours prior to presenting here, and that Advil 400 milligram PO, it was of mild effect. So it had a mild effect. Associated symptom, we talked about that left leg paresthesia. Treatment, we talked about the Advil he took, and this is first occurrence of lower back pain. In terms of pertinent positives, with the paresthesia, we identified the radiculopathy. It's an acute trauma, and this could mean fracture, dislocation, and misalignment of muscles, ligaments, and intervertebral discs. In terms of pertinent negatives, there's no loss of bowel or bladder control. There's no saddle anesthesia, which could, of course, mean cardiac apnea. His vital signs are stable. No family history of spondylosis, scoliosis, kyphosis, or lordosis. Costovertebral angle tenderness was negative, and there was no symptoms of UTI. So, in terms of he states that this is the first time he's seeking medical attention with his visit today. Medication history, he's on perindopril 2 milligram daily. He takes it in the evenings. He's on multivitamins, which he takes with breakfast. Allergies, he says none to medication as far as he knows. Environmental, he confirms, but it's mild. Rhinorrhea and itchy eyes, which settles on its own. Past medical history, we talked about the hypertension. He was diagnosed 1 year ago. He's on his perindopril, and he also adjusted his diet, and he's doing exercises, so lifestyle changes. So that's controlled with no sequelae. Cervical radiculopathy times 2 years ago, no concern. Social history, he is a janitor, and he lost his wife 20 years ago. She died tragically. He lives alone. He does not have a relationship with his only 2 sons because he has his history of being a chronic alcoholic. He did try rehabilitation treatment, and he's now sober for 3 months. He does smoke half a pack of cigarettes daily, and he's trying to quit. In terms of physical exam, general appearance, grimaces intermittently, especially with walking. No features of febrile illness. Posture is symmetrical anteriorly, posteriorly, and laterally. No evidence of scoliosis, kyphosis, or lordosis. SEEDS is unremarkable to cervical, thoracic, and lumbar spine. So there's no swelling, there's no erythema, there's no atrophy, there's no deformity, and there's no skin changes such as bruising. He does have a listing gait to the right side, I find. Vital signs are stable. In terms of palpation, I palpated the spinal process and the spinal facet joints and also the paravertebral muscles. It's only tender to the lumbar region, otherwise unremarkable. Other tests in terms of palpation, um, effusion was there was no effusion, there was no swelling, the temperature was normal. There's no crepitus, there was no atrophy, like I said. Uh, Limited range of motion noted with forward flexion down to 40 degrees, hyperextension down to 15 degrees, left lateral bending reduced, and also to 20 degrees, and also rotation to the left side only, with the hip rotation, active range of motion, adduction and abduction only to the left side, and also to the left knee extension. There was also limited range of motion in terms of, and his foot range of motion, dorsiflexion and plantar flexion, those were reduced only to the left leg. In terms of sensation, otherwise normal except the left medial and lateral calf and the left toe, sensation reduced, otherwise normal. The vibration test to the left toe, that was reduced. He also had, I did deep tendon reflexes to the left patella and the left Achilles tendons, those were reduced. I also, his popliteal, posterior tibialis, and dorsalis pedis pulses were all 2 plus. I did do the straight leg raise test to the left leg, and that was positive only to the left leg. I thought about abdominal aortic aneurysm. He didn't have any abdominal pain, but I did measure the width of his aorta. It was less than 3 centimeters. I did do deep abdominal palpation, and there were no visceral pain. Costovertebral angle tenderness negative, like I said, and there was no signs and symptoms of UTI.
Great. Well, now before you get into your differentials and relative diagnostic studies, I'd like to hear you quickly summarize your findings.
Okay, so like I said, Mr. V, he is 60 years old, male of African descent. Today he presents with a history of sharp lower back pain. He rates 10 out of 10 with paresthesia to the left leg. And he also described it as pins and needles, to the left leg. He has a known history of hypertension and cervical radiculopathy, which is of no concern today. He has limited, in terms of my physical exam, he has limited range of motion with forward flexion, hyperextension, and limited range of motion at his knee and hip with the left leg and left foot. He also had decreased sensation and decreased muscle strength at 3 to 4 to the left leg and left foot. He also had a positive straight leg raise test. Those are all the positives I found. We could go to his bedside and have discussion with him and also review my assessment.
That sounds great. Very well done.
Thank you.